Okay. Hi, everyone. My name is Kim Porter. I'm the Executive Director of Be a Part of the Conversation. I want to welcome you to our fourth, maybe fifth in a series of online programs. I'm already losing track. Our first was back on March 31st, and we've been here every Tuesday night at 7 with different topics. Tonight, we have a really great program and some wonderful panelists for you. We are really looking forward to getting back in person, but until now we're relying on Zoom, as so many of us are in our work lives and private lives and all of that. So just a few housekeeping items. As an attendee, you're in viewing mode only, so you're not visible on this webinar. We can't hear you either. However, we really want you to ask questions and share your thoughts as we go through the program. So I'm going to share my screen with you just for a second to show you a couple of things. Hang on one sec. Okay. All right. So this should look like most of your devices, but basically down here at the bottom, you'll see a Q&A box, and that's what you can hit to type in your questions. You can start doing that at any time. A few of you did submit some questions ahead of time, which have been shared with the panelists. So thank you for that. You just type in your question. You also have the option to make your question anonymous just by clicking that little blue check mark. And then we'll either respond to you that way or we'll answer your question in real time. You can also use the chat, same idea, no problem, type it right in there. And also you can raise your hand if you want to ask a specific question. Tessa or I will check in with you just to say, I'll introduce Tessa in a second. We'll ask you if you would like us to share your screen or audio and ask the question live with us. And this is the follow-up page that we'll have at the that you can visit tomorrow. This webinar is being recorded, which I'll explain in a moment. But that will be posted on our YouTube page, and the link can be found on this page, conversation.zone, which is our website, /pathways. And when you go there, you'll see the video, but also information about our presenters and lots of other helpful resources. Next week, just a little plug for what we have next week, we're going to be kind of targeting parents whose kids are in K through 12 and young adults. So we'll be talking about some of the challenges that are going on right now with kids who are young adults who are at home under the roof with a family, and there's some pretty clear evidence there are some issues with substance use. So we'll have Jill Adams with us from Onward Behavioral Health. That's the umbrella organization for rehab after school, rehab after work, and lots of other outpatient programs. They also have some inpatient programs as well, Pyramid and some others. But that'll be really great, I think. We'll have a nice panel for that as well. And I just want to remind you that every Wednesday night at 7, we have a parent support group meeting. Again, there's the website. There are lots of online programs or online meetings that we really encourage family members to attend. Of course, we absolutely encourage people in recovery to stay connected to their communities as well. But we family members, and I am one, we need lots of support too. So please stay connected during this time. So I'd like to introduce you. Oh wait, one more thing. Tessa Ricci, where are you, Tessa? Give a wave, please.
Hi, everybody.
Hey, Tessa. So Tessa's going to be helping me out. I just want to introduce her. She's our communications director. And so you might hear from one of us as you're asking questions. As I said before, we are recording this webinar. Your questions will not be visible as we're recording. The panelists and Tessa and I will see them, but no one else will. As soon as the webinar ends, you will, up on your screen, you'll get a prompt to complete a survey. We really appreciate it if you would complete that, because we need your feedback. We want to know what you'd like us to talk about in the future. You have options to kind of give us some of your thoughts and suggestions, and just really love to hear from you as we follow up. So I'm really excited to introduce our speakers. The first one you're going to hear from tonight is Dawn Sloan. Dawn, if you'll give a wave. Dawn is an interventionist and is the owner and founder of Recovery Care Partner, serving 6 states, I believe. And Dawn, you can correct me if I'm wrong, including Pennsylvania. We also have Bryan Bowen, the Chief Operating Officer and Chief Marketing Officer of Muir Wood Trusted Teen Treatment in Sonoma, California. Hi, Bryan. And we have Gary Fisher, the Executive Director of Cirque Lodge in Sundance, Utah. We're really spanning the globe here tonight. And we have Bryan M., who is a person in recovery. And I am just very, very grateful to all of you for being here. So thank you so much. And Dawn, we'll have you go ahead and take it away. Dawn, you are muted.
Hi, thanks. Kim, thank you for having me and inviting, and Tessa for inviting the rest of us. And for those of you that have joined the webinar, I appreciate your time this evening. And what we're going to try and do here is talk a little bit about how to deal with the environment that we're living with COVID right now. If you're living with somebody who is in an active addiction, or if you have a loved one that's relatively new in recovery. What I do, and Gary and Bryan Bowen does, is part of a continuum of care, and we'll each speak from our own perspectives about what it's like traversing the current environment. Excuse me. What I want to start off with is giving a few pointers about how to take care of yourself given the constraints that we're living in with COVID. You know, under the best of circumstances with healthy families, being in the environment that we're in is anxiety producing. And if you add on top of that, all of the unknowns that come with active addiction or with being new in recovery, they're just exacerbating one another. And one of the first things that I noticed in my practice probably 4 or 5, maybe 6 weeks ago now, from the clients that I support, is beginning to pull away from self-care, just because of the inertia that we've been experiencing. So paying attention to things like sleeping well. I mean, we're seeing this on the news every night. Sleep well, eat right, move your bodies. I just shared with some of my colleagues an article about Zoom fatigue, because if you're doing a lot of work on this medium, it requires a total different level of attention, and myself included, everybody that's doing this a lot is like, it's 3 hours into the day and I'm exhausted and I don't know why I'm exhausted. So self-care is key, but it's even more important for those of us that are in the recovery world. For those of you that are familiar with some of the language of recovery, there's an acronym of HALT, don't get too hungry, angry, lonely, or tired, because those can potentially be triggers for one to relapse. Or in this environment, sitting on our butts all day, getting over sugared or undernourished. And the absence of physical activity. My wife and I, a couple hours ago, I said, you know what, I got to drive up to the 7-Eleven to buy some lottery tickets for tonight. And we were like, oh, we've got somewhere to go, to just change the scenery for 15 minutes. And I'm in my mid-60s. I think I've driven less in this last 5 weeks than I have since I got my license. So it's being mindful about what we're doing for self, separate apart from who's, you know, if we have a loved one that's suffering or if we're in recovery ourselves. Let's see what my note says here. You know, how we become not our best friends when we're left by ourselves, and our thinking takes a whole track. I have a group of folks that are part of my support network that we all talk about going down that path when we hear the news about what's going on with Corona. And is that going to happen to me? Statistically, the likelihood of someone succumbing to substance use disorder is far greater than it is from succumbing to Corona. But there's a tendency from the folks I'm talking to forget that a little bit. And most important, to be kind to yourself. I'm asking my wife 27 times a day, why am I so tired? She said, don't worry about it, you just are. It's part of what we got right now. The second kind of bucket that I would suggest is to reach out, to not isolate. As many of you may be aware, substance use disorder is a disease of isolation. And given that we're being asked culturally to isolate, And one of the questions that I think we're going to address a little bit later is using, someone has asked about their son using Corona as an excuse to be using. Well, it's not an excuse. It's no more than my shoelace broke, or I won the lottery, or my dog ran away. But reach out. I kind of got off here. Reach out, either through Medium that you have, or your Al-Anon meetings, or your therapist. Isolation under the best of circumstances for people that are impacted by addiction is not a good thing. It'll help you feel less isolated, and will remind you that your fears and anxieties aren't insurmountable. There's one of the 4 gazillion sayings from the 12-step community is, together we can do what we can't do alone. And I think that that's that much more critical to hold on to that notion, whatever that looks like for you, while we're under the circumstances that we're currently managing. And the last bucket of thought here is to seek professional support. If God forbid somebody that had cancer or heart disease, you wouldn't think about trying to figure out what to do by yourself. You would call a cardiologist or an oncologist, and most of us would follow their guidance without a whole lot of question. Maybe get a second opinion. When it comes to substance use disorder, for my front end work with interventions and consulting to families about what to do, where to get started, the most common conversation, the initial conversation is, Don, and I'll hear the story, and they'll tell me what they think the problem is, and then they'll begin to tell me what the solution is. And I'll ask, well, I'm not sure why you're calling me if you're comfortable with what the solution is. And they're calling me because their solutions have not worked yet, and the progression of the disease has been going on for months, if not years. So if you're not sure what to do, reach out for help. That's what Gary and Bryan and I do. And there are countless resources for fee. There's 12-step resources available. There are communities. There's the work that Kim is doing. But do not figure this out by yourselves, folks. Just do not figure it out by yourselves. If you're struggling with boundaries, and I'll close with this, I'll give you an example. I'm working with a family right now who has a 27-year-old son that initially called me right when the shutdowns began, and they had called to ask for support to do an intervention on their son. And I was limited. I had made the choice at that point in time to not do any face-to-face work. And we were able to together get very creative, and what we've done is put an accountability. The first step, let me back up, was I said to the parents, do you think your son would speak to me? And they said, I don't know. I said, well, don't tell him he has to call me. Tell him you ran across somebody that might know what they're talking about addiction. Give him my name, give him my number, and say, give this guy Don a call if you want to. 2 days later, he called me. And what we have done since then is we've put together an accountability structure for this young man, where he becomes the arbiter of what happens. If he has agreed that if I'm able to be compliant with these guidelines that you, Don, and my parents have set up, then we're going to keep doing what I'm doing, which is a road to him being healthy. And if he's not able to be compliant, then he's agreed that at that point in time, he will go into inpatient treatment. So, and that's has required some collaboration with some of the partners that I work with. But the point here is that there are ways to support your loved one, whether it's to get them into treatment or support them new in recovery, that you probably might not be aware of. So reach out to somebody that does this for a living. So those are my initial thoughts, folks, about some things you can do while we're all managing this uncharted territory for ourselves.
Great. Thank you, Don. I think we were going to turn it over to Bryan now. Yes, Bryan Bowen. You'd like to unmute
Bryan, if you can
yourself?
speak to what you do.
Sure. Hello, everyone. I'm Bryan Bowen. I am the Chief Operating Officer for Muir Adolescent in Sonoma County. I think in the Bay Area, we've been in shelter longer than any other place in the country. I'm married and I have a 17-year-old daughter at home. My wife is stuck at home because she was laid off from her position at a winery. She works for the other team. So I have some experience in the household dealing with a 17-year-old who, is watching her senior friends. They're going to graduate. She can't be with them. She's trying to figure out ways to go and do things. I have a wife who is wonderful, but losing her mind. And I run a treatment center for adolescent boys. And the first thing I'd say is that, treatment is still happening. Good treatment centers have addressed the situation. Gary Fisher and I have talked many, many times about our centers and policies and procedures that have been put in place. We're lucky enough here to have COVID-19 tests. So we're actually able to test, and we have a facility we can bring the boys into, test them, and then we have an answer in 48 hours and we can bring them onto the campus. So, that's the first thing that I would say, is that resources are still working. We are behavioral health care, and we're essential. So the help is there. I can tell you that for us, we have the boys coming in, but we have to send the boys home as well. And that's where we see the challenge in the current environment, where they can't go to 12-step meetings. They can't go see a therapist one-on-one. It's all done by Zoom. And I think, it poses difficulties. As Don was saying, the disease of alcoholism is one of isolation, and the solution lies in connection. So it has been difficult to send the boys home knowing that they don't have the ability to go out and do in-person connection in 12-step meetings, to meet the people there. And so they're getting on meetings, and they don't know everyone per se. We're doing online meetings here at Muir Wood as a way to begin to introduce them to this kind of new way of doing meetings right now. But we hear from the families the difficulties that they're having. Again, I read through some of the questions, and the family that's struggling with, I believe, their son at home during this pandemic, and their son's using it as an excuse to use. I think that's probably really hard. That's the first thing I'd say, is that it's hard enough with the pandemic. It's hard enough to live with an active addiction in your house. It's really hard to have both. Anxiety and stress is up for everyone. And that's where, I just wanted to start by saying that, we're all, and good treatment programs out there are all open and taking it really seriously. Sometimes I think I'm running a MASH unit. I'm wheeling and dealing in thermometers and masks and PPE equipment and tests to make sure that not only are we providing a safe environment for the current milieu, the community of boys we have, but it's safe to bring somebody in, that our staff is safe. And I think that's the advice that I give, is that don't give up just because there's a pandemic. Reach out and find a facility near you that is still open, and that you can get your loved one into. I heard it said somewhere in the last 6 weeks that COVID-19 is a killer, but more people probably die each year from the disease of alcoholism and drug addiction. So getting your loved one help in any way and reaching out to someone is important. But that being said, I do have a wife at home, and I do have a 17-year-old. And I don't think there's any perfect way to do this. I'm on a 6 a.m. Zoom AA meeting with men in my life every day. We've done it for about 45 days. And these are men that I respect with a lot of years of sobriety. Some in the 40s, one with 50 years of sobriety. And I can tell you that to a T, each one of us realizes this is truly a day at a time, because we just don't know. Nobody really seems to know. So, you know, Don's point about self-care and sleep, eating right. I know my wife is struggling with it. Her sleep patterns are not as good because she's kind of stuck in the house. I just got a text, they're going to go get some takeout food. And that's like a big outing in our household. And that's like, you know, my daughter takes one of our dogs for a drive every night around the neighborhood just so she can get out of the house. The excuse is the dog likes it, but really it's because she just needs to get out of the house. So self-care is super important, particularly if you're in recovery. Self-care is important. You know, connection through Zoom, AA meetings. I was probably one of those guys 6 months ago that would have said Zoom AA. I don't know, like, really? I'm just not sure. Maybe if you live out in the middle of nowhere, but I got to tell you, from a personal level, it is saving my butt, and something that helps me stay more spiritual and in my place of recovery on a daily basis. That's what I got.
Thanks so much, Bryan. Don, did you want to introduce Gary, or shall he just take it away?
Sure, just real briefly. Gary runs a wonderful treatment center out in Provo, Utah, Cirque Lodge, and is one of the more seasoned and respected folks in the industry. So, Gary, it's all yours, man.
Well, thanks, Don. And I think season just means that my hair is grayer than most. And so if that counts, I've certainly got the most seasoning. But first of all, appreciated what Don and Bryan had to say, and welcome everybody. You know, part of getting in the solution is actually talking about it. So just the fact that you're all in this meeting tonight means that you're moving towards the solution. So I applaud everybody who's made the effort to be on the call or in the meeting, and to Kim for actually providing this platform, and thanks to Don for inviting me. Yeah, my name is Gary Fisher. I am the executive director at Cirque Lodge, which is a small treatment center out in, we actually have two facilities, one in Sundance and one in Provo. And, you know, it's, and we treat adults. So once they get a little bit beyond Bryan's bailiwick, then they kind of move into our hemisphere. And so we treat men and women 18 years and older. And, you know, one of the things that Don sees them on the front end, you know, through an intervention. It's kind of an interesting piece. Today, I had a woman who called from the state of Maine, and she called to talk about her husband, and was just in a quandary about what to do next. And got the opportunity to talk a little bit about intervention. Actually, gave her Don's name, being on the East Coast, although people, not a lot of folks traveling right now. I think that Don kind of alluded to the fact that a lot of folks are kind of doing these Zoom interventions, or at least interceding in a medium such as the one that we're using right now. And but at any rate, that was almost like rocket science for this woman. She had really no idea about you know, what that next step was. And I think, you know, one of the things that becomes dangerous for all of us is that you know, this is something where we decide that we're going to become the expert. And if I leave the audience with nothing else tonight, it would be, I think it was Don earlier who alluded to if we had a heart problem, we would probably first call our primary physician and say, who would be a good cardiologist? We certainly wouldn't get in and start doing the surgery ourselves, and we probably just wouldn't open up the internet and look down there and pick the cardiologist who had the prettiest website. And I say that from the standpoint that we have a pretty website, but that's not the reason that you should choose our program. You should choose our program because we're the right fit for your loved one. And it's people like Dawn out there that can direct you to the program that's going to work best for you. And sometimes it's Cirque Lodge and sometimes it's not. But you want to go to people who have experience they've done this for a long time. They have a lot of experience. A treatment center, and again, I speak from a place that we have a tremendous venue. But again, that's not why you would pick our treatment center. You want to pick a treatment center because of their clinical director, because of their physicians, because of their counseling staff. It's really the people in every facility that really kind of separates the wheat from the chaff, so to speak. And so, I would wholeheartedly advise everybody in the meeting tonight to rely on the therapists that you're working with or interventionists in the field. And if you don't have somebody like that, somebody to guide you, the Kim Porters of the world, then I would suggest that you get with somebody like that. And, one of the things that this kind of brings us all together. And so one of the things that we find is that there's certainly people in our lives that have walked this path before us and can help us with what they did and what worked for them. Just to talk a little bit about, I know that we're having this meeting tonight because the pandemic has lent itself to be just another obstacle for us in getting our loved ones help. But and again, I believe it was Don who earlier alluded to the fact that really, in the scheme of things, in here in the state of Utah, we certainly haven't had the destruction that the folks on the eastern seaboard have had. And I remember I was talking to a physician the other day, and I think at that time the state of Utah had 58 deaths. And of course, he was very, very, chagrined about the death toll and about the number of cases. And I said, Dr. Gill, I said, that's a Tuesday in chemical dependency and the opiate overdoses and deaths. And if you take the opiate overdoses and you add that to the alcoholic deaths this year, it'll be much more deadly, I believe, than probably what the coronavirus will end up being for our country. So, one of the things, this is the 800-pound gorilla in the room. And again, I think that it was Bryan who earlier alluded to the fact that, we all use excuses as to why we use. And I know, again, just as a piece of personal disclosure, I'm also a person in recovery. And it didn't matter what the reason was. The pandemic would have just been another, as ugly as this sounds, another convenience for me to justify the way that I used and drank. And, and the only thing that I think that this, as wild as this sounds, I think that the pandemic has been something that we will look back on, and really what it's exposing, I think, for a lot of our families is the fact that, I protected the house. At all costs, I did not drink or use in front of my family. But in the pandemic, we can't get away from it. I knew I was going to drink or use. If I was stuck in the house, it would have just been, a matter of when, not if, that my family found out that I didn't do this like a gentleman. And so as a result, I would use this as the opportunity. you know, we typically talk about the iceberg. You know, you see just the top ninth, and really our addiction goes much deeper and much wider. And so the fact of the matter is that, you know, most of us, we don't grow out of our drinking and using, we grow into it. We talk about it being a progressive illness. And unfortunately for all the folks on the meeting, if you're on this meeting, it's typically because we have somebody who's struggling. And what I would tell you is that's not going to get better for them without an intervention. Not sure what the intervention is, whether it's actually Dawn doing an intervention or whether it's an intervention with a therapist or a treatment center. But the fact of the matter is if we're hoping that we're going to be on our best behavior and this will just get better, that won't happen. So at any rate, I hope what I've had to share has been helpful, and turn it back to Dawn.
Gary, thank you so much for being here, my friend. And our last panelist is Bryan. I have had the privilege of walking next to Bryan from when he got out of treatment and was able to support him for a handful of months in a professional capacity. And from there, we've grown into friends and colleagues in recovery. So with that, Bryan, it's all you.
Thank you, Don. Appreciate the invitation. Thank you, Kim. I don't have anything as profound to say as the other three did. Sorry, Kim, but you know, I'll do my best. So I did 28 days inpatient. I'm nearing 3 years, and then followed up that with post-treatment services through Don, and Don really helped me reintroduce myself into my family and work life, which was for me was a necessity, and that was really helpful. I'm also married, and I have a 16 and 19-year-old at home, and my 19-year-old goes to Arizona for college. So, you know, as a freshman, so you know, a freshman coming up from college, right in the middle is, you know, it's just driving him crazy. So, you know, it's you know, there's a lot of family anxiety going on around here as well. As far as, you know, how someone new in the recovery, and I have to give Don credit for this. You know, there's definitely more stress, more anxiety on a daily basis than normal. But what I've been told to focus on is, you know, at this point in time, am I okay? You know, right now, am I okay? And usually the answer is, yeah, I am, because there's nothing impacting me right now that's going to horribly hurt my life. So as long as I keep focused on the now versus, you know, my other brain would like to keep focusing 14 days in the future, you know, I do a lot better. So, you know, there's the phrase, you know, taking it one day at a time, and I don't think it's ever been more prophetic than right now. And, you know, doing my best to find acceptance with how things are, because we can't change it. You know, one of the things about me is I'm a hardcore researcher. I always try to find out as much as I can about things, and no matter how much I research, I still can't change the facts of how things are, and you know, so that drives me crazy. So doing my best just to find acceptance of where things stand today is, you know, that's my daily battle. I also am a big, you know, sleeping is not going great. I don't think it's going great for many of us, but you know, doing our best to at least try our best to get those 8 hours makes a big difference. And then for me, the other big one is exercise. If I don't get my exercise in on a daily basis, I feel it quickly. It just, for me, it reduces the stress and the anxiety on a daily basis, helps with that. And then the big one, which has already been discussed, is you know, staying connected. You know, because this is a program of isolation. Our disease is is isolation, and I need to keep in contact with people through Zoom meetings, through texts, through phone calls, because as long as I do that, then I don't feel alone. I may be social, I may be physically isolated, but I'm not necessarily socially isolated. And, you know, if I can keep doing that, keep not feeling alone and staying, you know, that I'm okay right now, generally I make it through the day pretty well. So thank you again for letting me join in, and look forward to the rest of the conversation.
Thanks, Bryan. Bryan, what are you doing for meetings?
I do a Zoom meeting with Don, actually, and some of the other folks from our treatment center during the week, and then on the weekends I do in my local community here, I do a meeting on Saturday and Sunday with some local folks, just to keep myself connected with the local community, which is always nice. And so I you know, it's funny, I went before you know, COVID, you know, I was doing, you know, 4, maybe 5 meetings a week, and now I'm doing 7 meetings a week. So, you know, I'm doing more meetings now than I did before, and, you know, it's great. So.
Thanks. Kim, where do we go from here?
Yeah, well, first I just wanted to say thanks to everybody for all of that. And I think it's interesting too, just kind of bouncing off what Bryan just said. You know, we can attend meetings in California from Philadelphia or from wherever. It's kind of an interesting silver lining, I think, just having all of you with us. We do programs, you know, in a 5-county community in southeastern Pennsylvania, and look what happens tonight. This is certainly something that I'm really grateful for. So thanks to all of you. And I wanted to kind of get back to some of those questions that were posed ahead of time. And even though you all touched on the excuse question, I want to read it because I don't want to make the assumption that this is a person who's resisting treatment. It might be that there's someone, because what the actual question is, our son is using the pandemic as a reason to use. The lack of support, in-person meetings, and the stress associated with the pandemic are his reasons. What can we do as parents to counter this? So 2 things. This might be somebody who's had treatment, who's making up excuses for picking up again, but you know, yeah, it's not ideal. We all can agree that this is not ideal. We would much rather be together in a room holding hands and hugging and all that kind of stuff. But for now, we don't have that option. And maybe Dawn, maybe this is a question for you. I could touch on it too, because I work with parents a lot. What advice do you have for the parent who's getting that feedback?
I'm not 100% clear. Is this somebody that's in recovery or trying?
Know.
We don't know. Okay, so I'll go both lanes. If it's somebody that's in recovery or early in recovery, it's a simple answer on the surface, but it can be pretty complex. It depends whether the individual is really vested in being sober, being clean and sober, and they've just been waiting for something to hang a hook on to go back at again. And one of the ways that I describe the dynamics of addiction is if we could imagine it having 2 tiers to it, like one piece of plywood resting on top of another. And if we can imagine that top tier is representing the physiology of substance use disorder, what happens to the body and brain for somebody who has this disease, the biochemistry and the psycho-emotional piece of that. And then if we could imagine the bottom tier is life circumstances. There's a psychologist by the name of John Kelly that's done a ton of research, and he had a report come out a couple of years ago that 80% of people that have substance use disorder have some type of underlying trauma. So it could be, you know, big deal trauma or an emotional slight, but whatever the individual carries in this lower part of the equation is not causal for people to have addiction. In other words, we don't develop addiction in response to environmental circumstances. But that bottom tier can be a catalyst to keep reactivating the disease. So for somebody who's looking, so oftentimes when one gets clean and sober, in early recovery, our hearts begin to thaw out. We begin to feel things that we're not accustomed to feeling. We can begin to have thoughts that we're not accustomed to having. And there's an anxiety that builds. And what one does with that anxiety is one of 2 things. They either latch onto the tools that they've been exposed to, recovery, whatever that is for them, and they develop different coping mechanisms for the stuff down here. Or they go, the disease, which is waiting on the shoulder, goes, I have a solution for that discomfort. let's go numb again. So to back to the question at hand is the individual really vested in their own recovery? Have they latched towards the tools that are available to them? If it's somebody that's not in recovery yet, that's not been exposed to treatment, I think Bryan said it best, both Gary and Bryan, you know, for somebody who's in active addiction, and I too am a person in long-term recovery, you know, I'd use the fact that it was 67 degrees instead of 65 degrees as a reason to use. So it just falls into that bucket of something to pull on to say, yeah, I can't get sober because of whatever they're pulling on. Does that come close to answering the question?
I think so. I think that's great. Thank you.
Mm-hmm.
And we do have some questions coming in. I think this is a good one. How do we get the patient to you if we can't travel? I think that's probably a Dawn question too, actually.
Well, I'm gonna kick that over to Bryan, because I think I'm not, my company is not, well, that's not true. We've just done a couple of transports. Typically, transport is one of the things that we do. With COVID, there's just too much exposure right now. But Bryan, you've had some experience with this, haven't you, getting some guys in?
Yeah, you know, we actually have a kid who's about to come from Montana. He's from Colorado in his parents' home in Montana. And we have a transport service that we use that's going to drive to Montana and get him and drive him here. Again, we don't want him, he's been shelter in place there. So for us, that's important. And if we have a transport, we know he's going to be in this car, he's going to go from A to B, and they'll be able to keep him safe in between, and then we can admit him right into the campus. But there are plenty of reputable people, if this is an adult that can, you know, fly with your adult loved one who needs to go to treatment. There are plenty of men that can fly with men, and there are plenty of women that can fly with women if it's an adolescent. Likewise, that's how we do it. And we do it all the time here at Muir very safely. I'm sure Gary does it at Cirque as well occasionally. And again, you know, I'm available. So if anybody ever wants to get a hold of me and ask, I answer my phone all day, every day.
Yeah, just to kind of, I was going to say, just to kind of dovetail what Bryan is saying, certainly travel has, as we all know, is probably, well, it's gotten a lot less. But probably about 85% of our clients come to us from around the country. And, you know, one of the things, typically when we're talking to a client on the phone or a client's family on the phone, we certainly have the COVID screening questions that you probably all answered at one time or another. You know, if you have any symptoms, the dry cough, the fever, have you been traveling? Have you been exposed to somebody who might have it? And kind of interestingly enough, in the past probably week to 10 days, we've seen the travel schedule start to kick up a little more. As most of you probably seen by just watching TV, people are traveling through airports and there's not a lot of folks. I do agree with Bryan that I think, you know, there are plenty of reputable folks that have professional companion services that can help move folks to treatment. Although we've probably made more referrals to treatment centers in their area of residence than we ever have, saying simply, you know, up in Southeast Pennsylvania, we'll say, well, you know, Karen's in your area. You might want to call those folks, or if we get a, you know, Bryan was talking a little bit about Renaissance down in Florida or something like that. We've typically made a lot of referrals to people in or to facilities in their area of residence, just because we know that that's, you know, gives people some, I don't know, just probably some more self-assurance. I would say that, like Bryan, you know, as or like Muir Woods rather, and I'm sure like many of our fellow facilities out there, as people are traveling into our area, we have the ability to basically give them the PCR, the polymerase chain reaction test. And so within basically 24 to 48 hours, we can tell whether or not the person has the active virus. The antibody tests haven't worked out very well, I think, for any of us, only just because it just shows a moment in time. But I think most of the facilities today have the ability to do the PCR test and have the ability to quarantine people. You know, some people are calling it observation, some people are calling it quarantine. But basically what you're doing is you're isolating the person until you're sure about the test. To date, we haven't had any positive cases. So again, kind of in the Western United States, I know that this is probably attracting people more from the Eastern Seaboard. We just haven't had the kind of community spread that folks have suffered back east, but we are getting people traveling in, and like I said, about 85% of our cases come from states other than the Intermountain area. So we're still seeing quite a bit of travel.
I just want to add one, thank you, Gary. I just want to add one quick note here. One of my staff did a transport just day before yesterday. He was cleared, the young man was cleared to be admitted to an inpatient treatment center in Maryland. When he, on the way there, the young man's withdrawal really became very acute. When they got to the treatment center, he had a temperature of 100 and he had a dry cough. They had pre-approved him to be admitted. When he got there, they said, we cannot admit you. So we took him about a 2.5 hour drive to a detox that was willing to take him because they had the ability to isolate him. My point in sharing that is part of the answer to the question, Kim, is we have to have a community of providers that are willing to do what I just described, the scenario, because there's so many unknowns that we cannot predict. So that's why it's important to have this continuum of care providers.
Right, right. Yeah, I guess if you can think, if any of you have any thoughts about the right questions to ask when you're seeking treatment, you know, what's really important to know about how are you handling COVID-19, I guess. I believe most of these programs have something on their website about here's our protocol. Almost any of them, the homepage has some kind of link to here's how we're handling COVID-19. I'm assuming most of the folks you're working with have the same in place.
Yeah, I'm only working with folks, providers that have really solid. There's an organization, for those of you that are on the call now. It's called the National Association of Addiction Treatment Providers. That is a good initial filter for providers that operate from an ethical perspective, and that what you see on their website is actually what they're doing. So if you're just beginning to seek out resources, that would be a place to start to find where the ethical and appropriate treatment providers are.
Great. I just made a note to put NATAP on the list. And I think also when we're looking for recovery houses, transitional living, would you say National and NAR, National Association of Recovery Residencies? Are there any other good resources?
Bryan owns some halfway houses. He could probably better field that question.
Me?
Yeah.
Yeah. So
Me?
you know, a lot of states have organizations. California has an organization. Minnesota has an organization. I believe there's several around the East Coast. I think that's a good question because it's very easy to open up a sober home. You don't need a license. We that run treatment programs are governed by licenses. In fact, I'm governed by 2 because I'm also a group home. So we have requirements that we have to fulfill, and we have a state that checks in on us. So I think if you're not sure, reaching out to somebody like yourself or to a reputable treatment program near you just to make sure that it's A, reputable, B, they're really holding their clients accountable, and that they do have, in this day and age, some measures in place to help keep people safe, whether they're providing masks or requiring masks or these types of things. That's going to be super important.
Great, thanks. All right, so here's another question. It says, great information. Picking a great place is important, but most parents need a place when they're in crisis. So they choose the first bed. Basically, I guess they're saying the first place that they find that looks solid. I think a valuable question to be answered would be, what happens when I can then take a breath? Can I transfer my loved one? And how, kind of a separate question, how does insurance work? That's a much bigger question. But how about transferring patients?
Gary, you want to take that?
Yeah, absolutely. You know, certainly there are, well, I guess I'd go back to the start of the question. And, you know, one of the things, and Kim's absolutely right, or the person who's asking the question, we typically, you know, we make this move when it's a crisis. But, you know, one of the things that I would suggest to the families or the people who are listening to this call is that, you know, I think that my family knew long before the precipitating events ever happened that I was struggling with an alcohol and drug problem. And of course, what we do is we don't want to pay attention to it. It's the old proverbial kind of our head in the sand. Because it's easier just to believe that it's going to get better. I think we kind of talked about that a little bit earlier in the call. And so, you know, one of the things you know, it's the old Ronald Reagan line, trust but verify, you know. And so a lot of the folks have, as we were talking about treatment centers, you don't want to be the first call on the night that your loved one gets the DUI. That's not when we start searching for treatment centers. And really, you know, one of the things that I'll share is we're really, when I say we, the residential facilities, we're really the ICU of chemical dependency treatment. I mean, there are many stops before you're going to get to us, or there should be many stops. You know, the first place that we're going to go is not to a residential treatment center. It's more to a therapist in your area. It's more to the Don Sloans of the world. Those, in my mind, are the first stops. But again, that's easy to say. I'm immersed in the culture. I'm immersed in the industry. And, you know, as Kim pointed out, or the question, the person who asked the question, it's like we're typically doing this in crisis. But, you know, with that being said, that can people transfer from facilities? Typically, yes. It's, in fact, actually the answer is absolutely yes. They can transfer from facilities. The issue becomes this, is that we get our loved one who gets on the phone and they say, well, these guys at Cirque Lodge, they are just terrible. You know, this place is just miserable. The food's terrible. The people are mean. And, you know, oftentimes what I'll say to the families of the identified patient is, you know, have they been good self-reporters in the past? And of course, the family then usually comes back, well, what do you mean by that? And I said, well, do they lie? And of course, you know, that's a common denominator for all of us with substance abuse treatment issues, is that, you know, I want to appear in the best possible light to you. So I'm not going to tell you the truth. And the first time that anybody starts to hold a boundary with me, you know, I mean, I railed against that. I railed against any. So oftentimes it's when they're complaining the most, that's actually a signal that, hey, this treatment center is actually doing a pretty good job for you. But again, you know, to answer the question, it's America. You can always transfer. If sometimes it's not always indicated for the identified patient. In fact, sometimes what it does is it almost emboldens their strategy that if I can ratchet this up, my family will fold. In fact, I counted on that as a patient, because my family was not used to confrontation. As an addict alcoholic, I was in confrontation every day, so I was pretty spectacular at it, if I do say so myself. So oftentimes, you know, we're not helping achieve the outcome we want by pulling somebody out of a treatment center. I would, again, you know, I can't, I just can't implore individuals enough to get help in picking a treatment facility, because there certainly are, there's a lot of really very, very good treatment centers out there, and there's a lot that aren't. And kind of, again, whether it's picking the oncologist or the cardiologist or the podiatrist for that matter, you know, we're trying to find people who are reputable, who've been around for a long time, who have the license that, you know, the piece that Bryan was talking about, that are members of NAATP, that are JCAHO accredited. Those are, you know, and just because people are part of this, does it always make them a good treatment center? Not always, but it certainly culls the herd, and you know, it gives you a much better idea of who to pick. And then again, the Don Sloans of the world, the interventionists, your therapist that you've been seeing, or if not, you know, they typically have more experience in this area than we would as just a spouse or a parent, or even a child of a using parent. So hopefully that helps.
Thanks, Gary.
Kim, if I could just add a quick piece on the insurance. We are in network here at Muir, so I have numerous contracts, and we could probably do a series of these things on insurance, and I won't share my personal views. However, we deal in the world of medical necessity, and it's not what the doctors and clinicians at Muir think is medical necessity, certainly not what the family thinks. It's what Anthem, Cigna, Aetna, et cetera think. So I would just caution, if you're dependent upon insurance, it's difficult once you've gotten authorized somewhere, and then 3 days later, 7 days later, et cetera, you want to move your loved one. Re-getting an authorization for medical necessity at our level of care is going to be difficult at best. So, you know, to Gary's point, yes, please get in, find a place, and, you know, just be aware that if you're using insurance, it may be a little bit more difficult to move them.
I think so many times when we're talking to families who are in that crisis mode, you know, we're in a panic, we're trying to find the right place. I just wonder if you have any thoughts, any of you have any thoughts about detox as kind of an opportunity, you know, just a place where we can send our loved one, maybe it's even county funded or something like that, and then have that period of time be when we're looking for the next level of care. Any thoughts about that? And might be even something to handle the question of insurance. Like if I, you know, obviously that's one of the biggest hurdles is who takes, who, you know, who's in my network and all that sort of thing. So getting them into detox initially and then getting your search going while they're there.
Yeah, absolutely. I mean, they're safe. If they're in detox, they're safe. And it's a different level of care than residential. So even if you're using insurance, it's not going to affect what you can do. And my guess is Don's probably done multiple interventions in detoxes, because absolutely, Kim, it gives the family a chance to breathe. Mm-hmm. Your loved one is safe, right? Because it's crisis. Loved one's safe, you can breathe, you can make some phone calls, you can then decide the next step. So that's absolutely, yeah, that's a great plan.
Thanks.
And the detox gives the notion of slowing down so that you can speed up. And when we're in crisis, we want to just get to the answer. And we frequently miss a lot of very important data along the way. So a detox is a great buffer zone to, you know, just echo what Bryan said, your loved one's safe. And that's a very common scenario. As far as the insurance, the only, Every provider contract with each insurer is unique. The only way that I'm aware of to get any headway is to identify 1 or 2 or 3 at the most potential providers, call the admissions office, have your insurance information, give it to the provider. The provider has staff that will call the insurer and find out exactly what coverage there is and then report back to the family. Gary or Brian, if you know of some other way to do that, but I think that's the only way to get definitive information. Is that correct?
Yeah, I think, just to kind of add on to what Don and Brian are saying here is that, almost every facility will do a verification of benefits for you and let you know what your benefit is. But one of the caveats that they will always say is a benefit does not guarantee payment. And so just to go back a little bit to what Brian was saying there, it's, what you believe is medical necessity is the key term. And what Muir Woods believes is medical necessity, or Mark believes is medical necessity, or Cirque Lodge believes is medical necessity. That's not necessarily what Cigna believes is medical necessity. So, hope for the best, but plan for the worst. And because I think that if we have one issue, and we take, to come to a facility like ours, we're using an out-of-network benefit. But almost always we have, and in fact always, not even almost, always, our admissions people are really just preparing people to be prepared that their insurance probably isn't going to pay as the benefit states.
Thank you.
Mm-hmm.
All right, here's a question that I know you all probably have something to say about. Maybe Brian M might want to take this. Why is addiction a disease of isolation?
Sure, I can jump in. Sure, everyone else there is going to comment as well. But at the end of the at the addiction, we sort of have a singular concentration and focus, and that is, how can I get whatever I'm addicted to? Everything else sort of becomes secondary, and that is, as I think as Gary said, when someone has the nerve to get in the way of you getting that substance, you're probably willing to lie to them and potentially cut them out from you, especially if they are getting in the way of you getting to that substance. So when you keep going down that path, isolation is what occurs, and because there's a saying we say is, I was a bar drinker, but I was alone a lot in bars with a lot of people around me. So it's still, you're still isolating, even though you may be around people, because you're not interacting with them. You're just worrying about getting the fix that you need, and that's the isolation that I think of.
Thanks, Brian. I'm going to make a brief offering from my own story. I got sober when I was 30, and my mom was single at that point in her life, and fully functional, owned a business, wrote a number of books. I would call her on like a Wednesday night and say, "Hey, Mom, you want to go out to dinner Friday night?" She'd say, "Great." Friday night would come, I wouldn't show up. She'd call me Saturday or Sunday. This is pre-cell phones. I wouldn't answer the phone. Monday or Tuesday, I would answer the phone. And through her anger and through her tears, angry that I frightened her and relief that I wasn't wrapped around a telephone pole somewhere, I would resolve with every cell in my being to not do that to her again. And when I made that proclamation to her, I meant it. It was very authentic. 3 weeks later, a month later, I would do the same thing. And I did not know why I could not do that. And with every iteration of my doing something that violated my own value proposition, there's this knot of shame and guilt and remorse that got tighter and deeper and darker inside of me. And I've been around recovery for 36 years. Everybody that I know that has this disease has their own version of that story. And what that nut does is that pulls us inside. And that's the isolation. There are plenty of people that have this disease that appear gregarious and engaged and larger than life, but the inside life is a common thread for all of us, and that's where the isolation lives, and it manifests in a lot of different ways. So that's when I say it's a disease of isolation. That's what it means for me.
And I have to kind of chime in a little myself, because I think you all know this is a family disease, and we have a lot of family members on this line. And I can tell you, 11 years ago, we were in the darkest place of our lives. Our son was not present, not there, ghost of himself. And we were crazy people with our hair on fire, but isolated, absolutely. And the shame and guilt and all the things that we do to ourselves just gets us absolutely nowhere. We can curl up with every Melody Beatty book under the sun and try to homeschool this. But, we really try to get these family members to connect. And the minute they're in, it's the same as the person with the SUG. The minute we're in the room with another person, and you see it all the time, like somebody who can't even make eye contact, who says, my son is in jail right now. And then we say, like, can anybody else share where they're, and all the hands go up, like, yeah, we've all been there, and immediately there's a little bit of weight lifted off their shoulders. So we absolutely get as sick as, if not sicker than, our loved ones in this disease, and the isolation is definitely there. Here's a question for Bryan, I believe Bryan M. So I think this person was asking this based on your original share, Bryan. Do you ever answer the question with, and I'm not sure exactly what question she's referring to, no, I'm not okay right now. I think you said something about that earlier. So no, I'm not okay right now. And if so, what do you do in that moment to get back on track?
That's when you need to pick up the phone. That's when you need to reach out to somebody, and don't let yourself sit there alone with how you're feeling, because that I guarantee you'll feel a lot better if you're willing to pick up that phone and call somebody and discuss what's going on with you at that moment. That's what works for me.
Nice. So someone has a question about, so somebody who is in active addiction, obviously we know that they're often not taking care of themselves. And they're basically asking if you feel that there's less fear about COVID-19 for somebody who's in active addiction.
Go, Bryan.
Yeah, I mean, you don't have any fear about anything except running out. I mean, the situations I've put myself in the past, you would think I was insane. No, I can tell you, I think I've had this conversation with Gary. The clients at Muir Wood, probably the clients at Cirque Lodge, it's just another day in treatment. They're not fazed at all by what's going on with COVID-19. And they're in treatment. So you can be pretty sure they haven't used for some period of time, even if it's a day or a week or 3 weeks. Those that are using won't be fearful of it. They'll be more interested in getting what they need and using, unfortunately.
I was running around when AIDS was at its peak, and I was terrified of contracting AIDS. Having the fear was very different than my behavior, though. So I had the fear, but it didn't stop me from doing stupid things that put me at risk. And I would offer that that's probably what's going on now as well.
Great point. So one more live question, but hopefully we'll have time to get some of those others that were asked in advance, because there are some good ones. This question is suggestions for families that no longer have financial ability to help their adult addict without insurance. Many of us have been kind of dried out the bank account. So anyone to take that?
Gary, you want to do that?
Yeah, actually I can. Interestingly enough, today I work for a facility, this is not where I thought my career was going to end up, working in a facility that's, I think, in any stretch of the imagination would be considered very high end. I worked for a long time for a group called Utah Alcoholism Foundation and worked with indigent populations. And no money's tough. I won't kid you if there aren't funds. And I can really only speak about our area here in the state of Utah. But there are state and county funded programs. The programs are actually, they're good. They're quality programs here. A lot of times, you know, I mean, are they the Taj Mahal? No. But the fact of the matter is, you know, to Don's point about having, he had the fear, but it didn't change his behavior. And some of the places I put myself in, and then you can imagine how indignant I'd be that somebody wanted me to go some sort of state and county funded program. I mean, my God. And but the fact of the matter is, you know, I put myself in really incredibly dangerous and just really loathsome situations. So the fact of the matter, but I could get pretty prideful, indignant when it came to where I was going to go to treatment. But with that being said, I think that no money is tough because then you're on the state and county funded list, and those lists are quite long. But what my experience in working for the UAF and in working with other state and county funded programs that were here in the state of Utah is even some funds that you could add to that would bump you up that state and county funded list and get you, because they're like any other business, they need cash to survive. And so any cash whatsoever tended to move you to the top of the list. And in our state, what would happen is there were probably 7 or 8 programs that took inpatient residential clients all the way from the Salvation Army to, like you said, the Utah Alcoholism Foundation to Odyssey House. And so as those patients came up that list, then they could, you know, move into one of those slots. But it's certainly helpful, you know, whether it's $500 or $1,000 or $1,500 to be able to, you know, to talk to the county placement officers about having those kinds of funds. But if it's zero, there's still treatment, but there's no doubt you're in a pretty long queue.
Thank you. All right, so we have a couple of those questions that were sent in early. One is, what are some treatment plans for young adults addicted to methamphetamines and heroin?
Either one of you guys, do we know how young? Is it an adolescent?
No, young adult, just young adult. So I'm going to guess 18 to 25.
That would be you, Gary.
Well, you know, one of the things that I was actually going to pass this off to one of the other two Bryans, but I can absolutely talk about treatment plans. And, you know, I think one of the things that for those of us who can remember our abnormal psychology classes, one of the things that kind of comes into an assessment is the duration of use. And so, you know, a lot of times we'll get that question about what makes a person an addict and what makes somebody a substance abuser. But I think, you know, the part for the treatment plan, and unfortunately, certainly with opiates, the relapse rates are great. So one of the things that, you know, I think our clinicians, when they're meeting as a multidisciplinary treatment team, that they are suggesting to families all the time that we want to extend the duration of the treatment. And when I'm talking about extending the duration of treatment, you know, we're talking 6 months to a year. Now, that's not entirely at Cirque Lodge. In fact, maybe only the first 30 to 60 days might be in our facility. But then it's about, you know, finding additional treatment resources. And to, you know, Bryan brought up some great points earlier about, you know, finding sober living facilities. And I think, you know, typically the facility, the residential facility that you're working with, many of our colleagues out there, we don't, but many of our colleagues have sober living facilities attached to them. And at the very least, you know, they're going to be able to make a good recommendation. I mean, I want to make, in fact, actually, to tell you the truth, make a lot of referrals down to Renaissance. I heard Bryan talk about being at Renaissance earlier, make a lot of referrals down there because we want to have a good outcome, because what and they do good work down there. They, you know, they extend the care, and then they're able to even, you know, make another referral to another. A lot of people will call them step downs. I like to talk about it as a step forward, you know, moving them out away, kind of getting them off the umbilical cord a little bit. But a big part of the treatment plan is about duration of care. And I think any good quality facility, it's all about giving your loved ones some different, when we came in, you know, our only coping strategy is to use. Man, that's horrible. What should we do? I don't know. Let's smoke a joint. Hey, that's great. What should we do? I don't know. Let's smoke a joint. And so it becomes our coping strategy for everything. And so really what a good treatment center is going to do is going to give some different coping strategies to rely on. So when it starts to go to hell in a handbasket for you, that you have some different things on board other than putting a needle in your arm or smoking a joint or having a cocktail. And so, and good treatment plans are always a combination of individual therapy, of group therapy, of family program. I would just, I'm a big believer in this, and that, you know, if the treatment facility, we're talking about how to kind of pick a treatment facility, having a robust family program, I believe is, because I think it was Kim earlier who talked about it's, you know, we're in this together. I mean, this will sound kind of horrible for the families out there, but as my mother got better, as she learned that no was a complete sentence, I got better. And so, you know, a good treatment center, and that would certainly be part of the treatment plan, would be to, you know, give a family those skills, because, you know, the addict alcoholic will find the weakest link in the chain. And so everybody needs to be on the same page.
You're here. You're singing my song. I love it. So a couple last questions. Someone's asking about the cost of having a sober companion. Don, is that something that?
Yeah, yes. Sober companion is very expensive. And it depends on whether we're looking at, or the variables, I should say. Is it a sober companion 24/7 for a day or two, or for a week or multiple weeks? Is it a sober companion from 8 in the morning till 5 in the evening? Typically, at least the way that we're structured in my company, is if it's something less than a 24-hour period, it would be an hourly rate in the range of probably a couple $100 an hour. There's some other variables. And then the longer the period of companionship is, the unit rate or the unit fee goes down. For a month, if someone said, we want somebody with my loved one 24/7 for a month, that's $17,000, $18,000, $19,000 for something like that. It's exorbitantly expensive. So that's the answer to that question.
Okay, and I'm guessing there's a spectrum of support there. So I know in Pennsylvania, we have certified recovery specialists, which are just, you know, peer support. Is that something that might be an option? It's obviously not a full companion, but.
Yeah, peer support is great. And there are more and more certified peer support folks available. There's a limited skill set for peer support. So if somebody comes out of treatment and they they've got debilitating anxiety, but they're engaged in their recovery, having a peer support person would be ideal. I have one of my staff up in Delaware right now with an 80-year-old woman who just got out of treatment, who has some dementia challenges. We're with her 24, I've got staff there 24/7 with her right now. And the family said, let's try a week and see how it goes. We're into week 3 and they're probably gonna want another week while the family's figuring out what's the appropriate environment for her. So that would be like the high end of the continuum. Peer support would be the other end. And there's probably a dozen clicks in the middle there.
Sure, right, great. Oh, we have one more question here. Hang on one second. Is there any such thing as a parent belonging to too many support groups or communities? I'll take that, absolutely not. I know lots of folks who hit a meeting every day, just like our loved ones sometimes do, depending on where we are. And again, you know, I like to look at the positives in any situation, and I do think we have those opportunities right now. And I think we've talked about this before on these webinars. There are certainly people and family members as well who this might be the time that they're more likely to engage in a support group, because it's really hard to walk in that room for the first time, as you all know. And maybe it's a little less intimidating to say, like, you know, we talked about excuses earlier. There aren't a whole lot of excuses for not at least like sitting there on phone mode, just listening in for a meeting, you know. So yeah, often and all that kind of stuff. Yeah, no question about that, right?
Let me add a footnote, and I think this is John Kelly again, one of his research. 20% of people that need 12-step type of support have social anxiety. So there's this anathema there of, gosh, if you want me to be part of a community that I'm scared to death to go be part of. So this is a great alternative that we have, right?
Exactly. Yeah, I was talking to a parent of an adolescent who's been dabbing, you know, high potency THC, which is, I don't know where all of you are. Love to know, Bryan, Bowen, what you're dealing with out there, but this is a huge problem for our adolescent community right now. And because we have medical marijuana legalized in Pennsylvania, and I have a feeling recreational is right around the corner, unfortunately. But, you know, I was like, you know, there are online marijuana anonymous meetings, and why not just be a fly on the wall for that and see if you pick anything up, you know, get a few seeds planted there. So I really want to thank all of you, and I want to ask if you have any final thoughts. We're almost at 8:30 our time, Eastern time. I know it's earlier for some of you guys. Any last thoughts that you want to share?
You know, if I could jump in for just 1 second, and that's that because when we were talking about the sober companions, and I would actually say this about the interventionists, and I think it's important for everybody on the call to know that I don't have a dog in that fight. We neither do sober companion work nor do we do intervention work. But I think it's important for the families, and we talk about this all the time, that you don't become the policeman, that it doesn't, you know, whether somebody's coming out of treatment to all of a sudden you're going to be the person policing their behavior. I think if there's something that leads to a bad outcome, it's all of a sudden, you know, the family's anxiety getting involved with, you know, the patient and their behavior going forward. You want to be part of the process, but you're not responsible for the outcome. And I also believe that on the front end, I think Dawn was being fairly modest right there, because when you think about it, whether it's the intervention, somebody who's orchestrating, you know, getting all of the family together, and intervention does work. I just have to share that. It might not work in that moment, but I promise you that once the seed is planted, the identified patient knows that for, you know, the proverbial gig is up, and everybody starts getting on the same page, people will come to treatment. I guess that's the dog in the fight I have, is because they'll end up coming to treatment. But then on the back end, you know, a sober companion, they're with your loved ones 24 hours, 7 days a week. at times. I mean, I couldn't imagine what they would have had to pay somebody to be with me for 24 hours a day. I mean, you couldn't, there's probably not enough money out there, but that's what a pill I was. But the fact of the matter is I just think it's important that the families don't get into being the police officers. And, you know, you've invested in this treatment experience, whether it's money, emotion, time. So, you know, those are the things that assure the best possible outcome. And I would not shy away from, even if you had to save money in the treatment, you know, shorten the treatment experience or even, you know, change the treatment center you picked, I would invest in those front end and those back end services.
Yeah, we definitely decided not to be house managers once our son got sober.
Very good.
Not interested in checking his the 3 Ps, right? The pockets, pupils, and urine. So, yeah. Anybody else have anything they want to share before we say goodnight?
I'm just going to say quickly that high potency, high content THC is extremely dangerous, particularly for adolescents and the emerging and still forming brain. I think they made a mistake here in California when they legalized it and they didn't put any requirement on the strength. There's a poster of the Grateful Dead behind me. I do live in the Bay Area, and they are all very good friends of mine. And those that still smoke grass will not smoke high potency THC products. So if that doesn't tell you something, I don't know what does.
Bryan, did you want to say anything? Because I'm going to say one thing.
Thank you for the opportunity to be here, and enjoyed the conversation.
Thanks for joining us, Bryan. The 3 leading causes of death in the United States are cancer, heart disease, and substance use disorder. Of those 3 diseases, the one that is most treatable is substance use disorder. So though there's hopelessness by the time somebody calls me, this is a treatable disease. You just need help to figure out what the path is to get to the right type of support. And Kim, thank you it's an honor and a privilege. Thank you for having me and allowing me to invite my colleagues. I'm honored to be part of this. Thank you.
Thank you. And that's a beautiful way to wrap up. Thank you so much, everybody. And please, when you leave the webinar, take our survey and give us some feedback and let us know your thoughts for what you'd like to have us do next. Thank you all so much. I'm so grateful. Really appreciate it. Hope you all are safe.
Thanks, Kim.
Have a wonderful evening.
You too, Kim. Thank you.
Thank you.
Take good care.